Good afternoon, everyone. So thrilled to have you join us. I'm Helen Rosenfeld. I'm the Executive Director of the Massachusetts Science and Engineering Fair. And we're thrilled to be offering this series with various industry and academic experts. Today, our guest is Rajni Aneja. She's with a company called Sanofi, and I'm going to hand it directly over to her to speak about her work and her background. I will just share that you're all on mute with your videos off, but feel free to put questions into the chat function. I'm happy to facilitate that. And as we get through the talk, we can also take you off mute so you can ask your questions directly. So with that, on to you.
All right. Well, thank you, Helen. And also sincere thanks to Wendy. She and I spoke probably a month ago when I expressed my interest in doing more for the world. And I think the timing is perfect as we are all experiencing unprecedented times. I think the background that I have, it has made me think in how many ways a human being can be productive to the society and actually contribute to the society. So just to share a little bit about me, I am a physician by training, a family physician who delivered babies for probably, I would say 7 to 10 years, but got very much interested into the business aspect of medicine and decided to go to business school. And it was actually horrifying to my father when I said to him that, after 13 years of medical school and residency and all those 48-hour calls and lack of sleep, I think I'm better suited for business. And he looked at me and he said, and what are you going to do? And I said, I don't know, but I will find out. And we're talking about a time when not many physicians were going into business. But my only explanation to him was, this is what inspires me. I think I have done enough that I want to do more. I want to have greater impact, reach out to a lot of other people. So let me do it. So this is how my transition from medicine to business happened. And as I got interested into business, very slowly, and I am aging myself, iPhones were not out at that time, I actually got interested into technology. So now when people look at me, they're extremely confused. They're like, what do you do? So you're a doctor, but you also do business and you also do technology. But when I look at myself, I say, it's eclectic. I have followed my passion, I have followed my path, and I think I can connect all these 3 dots and contribute to the world. So just to give a little bit of my professional background, I actually joined United Health Group, which I'm not sure how many of you know, but it's the nation's #1 healthcare insurance company or a payer company. And I was doing their wellness programs. So a lot of things that now you see on TV about healthy exercise, weight loss, or fitness, or meditations, or spirituality, I would say United Health Group was ahead of their time, and they recognized it that health is just not what your physical health is. It's mental, it's spiritual, it's physical, it's community, and they were working on it. And 4 years into that program, I actually ended up becoming Chief Medical Officer with WebMD. And I know you and I cannot interact, but I was going to ask how many people have gone onto the WebMD site and then looked at the symptoms and said, something is drastically wrong with me. And it's really not the case. True story sharing. I was on a plane flying to some place, and the person sitting next to me, I just by mistake admitted that I am Chief Medical Officer with WebMD, and this person literally was saying, "Oh, you guys provide so much information, and I'm always on WebMD, and the symptoms tell me that I have a great disease, so you should change it." And I said, "Oh, okay. Thank you for the feedback. I never looked at it that way, but if this is what our consumers." And consider that this was one of the first digital platforms. Now you hear the word digital a lot. I mean, everything. I mean, I'm pretty sure most of you or some of you have iPhones or Android phones, or you're on iPads, or Google Chromebooks. And the way we are interactive even today, it's digital, it's virtual. So I was trying to do this pre-iPhone time. And people looked at me as crusader or an evangelist and thought I have lost my mind. And I said, no, I believe in this, and I feel like the technology is the future. And lo and behold, it took a pandemic to figure out that technology is our future, and how physicians are interacting with healthcare systems or even with their patients. So my story as it continued, I was living in New York, then I moved to Boston for one of the Harvard Hospital. I was their executive vice president and chief strategy officer, and then did a lot of similar roles with Novartis and now with Sanofi around digital transformation. So big words, not to get confused, but what does this mean? Like, what exactly do I do? And how do I combine my experience in medicine, which is still, I still have an active medical license in the state of Massachusetts, even though I don't practice, but how do I keep the current medical knowledge, but then also we are helping the end user who are actually our patients in the end. What are we doing? So I thought it's very timely that I should share an example. And one of the great example now, as we all know, that because of pandemic, our healthcare systems are strained. They're overburdened, they're overwhelmed. Physicians, nurses, healthcare providers, many frontline workers, they're all doing their best. Where does technology enables this? So I don't know how many of you ever had a chance to experience, but something called video consultation. And now you can actually video consult with your doctor or a nurse practitioner or even a pharmacist. So here is a great example in the era of COVID that you can still stay safe in your home, sanctuary of your home, safety of your home. But if you have a trivial medical issues, like you have a pink eye, a doctor on the other side, like I am speaking with you, a doctor on the other side can take your history, look at your symptoms, diagnose it, and then provide appropriate prescription. And you are all set. It's all done in 20 minutes and you never left the comfort of your home. So this is a great example of how technology is enabling medicine, but in the end, it's also a business because it is run on platforms. It's a software, it's the use of computer, but it's a nice perk to have. It's convenient, it's quick, it's access. You're not calling your doctor's office, waiting for 3 days to get an appointment. So we have made this possible. And this has been actually pretty operational for many years, but more and more people have utilized it in the event of pandemic. So one example. Another example that comes to my mind is the apps, and I'm pretty sure you guys are probably more advanced than I am. Like the apps like Spotify or Pandora or other things, or Netflix, whatever you have it. So we have now COVID apps. I mean, we can trace where the infection is happening and where people are moving, mobility data from our cell phones. So another great way to know where the infection is happening, how to control it, how to prep for it, and how to react to it, respond to it. And there is preparedness for this. And technology is enabling that happen. Another great example is, and this is probably like we all take temperatures, and we have this old-fashioned thermometers of the past, which you can put under your tongue if you go to your doctor visit, or under your armpit, and it takes the temperature. Well, guess what? Well, now we have new technologies. We have temperature, which is connected to temperature scales. It's called Kinza. Not sure if you guys have heard it, no need. But what I'm saying is we have progressed so much that this connected thermometer think of it as connected thermometers like you have Google Home or Alexa, because they're all Internet of Things. And again, big terminology, but real life practical applications. So when this thermometer is connected to your Bluetooth, it's actually recording data. And it also tells us where people are who are running temperature. Are they running high temperature or lower temperature? So in the case of pandemic, it's really very relevant. It's crucial because it tells us, and epidemiologists and physicians and other people who are working at the front lines, how we react to it, how we prepare to it, and then what are the best measures to take. And if there is an outbreak, how to control it and control it effectively. So a few of the examples here. One of the things that I forgot to mention, if all of you can see it, I'm wearing my Fitbit, or most of the people nowadays have trackers. What good is that? Like, how is it monitoring health, right? Because it monitors your heart rate. It also monitors your sleep pattern, stress level, which could be very high during this time or low. And, you know, considering me, I'm living with a 10-year-old child, so on and off, it is high or low. But these activity trackers are a great way, and actually a very simple example of connection between health and wellness, technology, but ultimately leading to better outcomes, better patient care in many ways. Like I wear my Fitbit every day. I'm an avid runner. I run every single day. But most days I would run, I'm not a marathon runner, but a recreational runner, and occasionally do strength training. But what it does is it motivates me. It sends me a reminder that you need to be active and get 250 steps every hour, or log your water, or log the food you are eating, or did I sleep well? And for me, it was actually very interesting, just personal story sharing. When the COVID started, I would assume that most of us were in different physical and mental state. And it was interesting to see how my body responded to it. And with a period of anxiety of not going to work or not being able to go outside, and also homeschooling my 10-year-old, which can be a full-time job. So you're running 2 full-time jobs at the same time. My sleep was completely out of whack. It was wacko. But slowly, as we all adapted to this new norm and wearing masks and taking precautions and observing social distancing, and slowly we got into the rhythm. I got into the rhythm and monitored my sleep, monitored my eating patterns or fitness pattern, and came to a point that I was, or now, that I'm doing very well. And what to me was relevant here is how you take this information, customize it just for me, what Rajni wants, what Rajni is doing. And it doesn't tell me what Tom, Jerry, or Ben are doing, and it is not Ben and Jerry ice cream. It's like other people, what they're doing. It actually talks about me. And that is the beauty of now connection between technology and medicine. It is personalized. It knows about Rajni. For Wendy, it will be a completely different set of recommendations. For Helen, it will be different. So to each, to get to a level of granularity, what each one of us need may be different at different times, but these devices are able to keep track of it and then also spit out information which is useful for monitoring purposes. And I'm not near anyone, so this is remote monitoring. And I think this probably leads to another important, I don't know how many of you are, like when growing up, I used to think and somehow it paid off. So I'm happy about that. My father was an engineer, so he was really very good in math. I would like to say that I was okay, average in math, but I was quite fascinated by biology. So of course, human body was very interesting to me, and data became interesting to me. That how do we know, in like even just in a 24-hour day today, My Fitbit has collected so many data points for me. What was my heart rate when I was exercising? What was my heart rate when I was sleeping? Or what was my stress level when I had or maybe today, maybe right now, what is my stress level? It doesn't say anything, but I think I'm okay today. Things like that. So you get lots of data. And as you are thinking about your journeys, you have to think about it, what all of this makes sense, or how it makes sense. And the way it makes sense is it's data. All these multiple touch points in a day that we collect, either on our devices or remotely or through apps, or another great example of Alexa or Google Home. They are run on artificial intelligence, which means every time you tell that machine to do something, it learns something about you. And it continues to learn something about you. And after a while, it actually becomes so smart that it will spit out recommendations. And I think you guys know that. A relatable example here is Amazon. And whosoever uses Amazon for shopping, I mean, they're brilliant. But they have their data set to what Rajni wants. If Rajni is very heavily into perfumes and anti-aging creams, then that's what they will show me. Or if I am into ice creams, that's exactly what they will show me. But how did they know my preference? It's because I clicked on those ads. Every single time I click on an item, every single time I scan an item, there are data points. And this data point, they are creating an intelligent system about me. And as I go more and more on Amazon or Netflix, then they say shows that you would like, or things that you would like, or you would prefer. And I'm not nerdy or anything, but I think you, at some point you say, okay, if I am doing digital and I'm doing analytics and I like to transform big companies, how do I make that happen? Because we're not talking about one person, Rajni. We have so many patients. We are a global company. We're in more than 180 countries. We actually interact with healthcare providers on a daily basis. So how are we making sure that we are presenting this information to our patients, to our healthcare providers, which is relevant to them, and leave the white noise? And it's all enabled by data. So data makes us smart, and then digital make it happen, which is the technology piece. And ultimately, we apply some clinical principles to it to say, can we bring this ecosystem together? So I think my world is fascinating. It's exciting, it's innovative, it's disruptive, it's transformative, but a lot of time it is also crazy, in all honesty. But that's a good crazy, people who like to push the envelope, people who actually say that they want to do more, and how. Just a real example in my life, when I was a practicing physician, one of the things that I kind of felt, and it was very near and dear to my heart, was I only used to see maybe 15 to 20 patients a day, and great humbling experience, gratification, lovely to interact with patients in person and get to know them and really be their doctor. Like I said, I was a family physician, so I would see everyone from grandmother to a newborn baby and everything in between. So for me, I was part of their family and help them with their health issues or wellness or whatnot. But I always kind of felt like, and this is just me, I kind of felt like I'm missing something and I'm not reaching broader folks. I'm not reaching broader population. The impact that I have is only and that was just my reason going to the business school, that it was very limited and I wanted to do more, and I didn't know what to do. And like I said before, that when I went to business school, not many physicians actually chose the path to go to business school. So I was looking for something out of the ordinary, which people have not done. I was willing to take a risk. I didn't know if that risk would pay off or not. Wasn't even sure what people or physicians in administrative roles do, but it it encouraged me to embark on a journey which was unknown to me, but very fulfilling. I learned a lot of business aspect of it. I learned how you grow an organization, how you take them from from plan A to plan B, and literally create innovative strategies around it. And my world became exciting. But it was not all fun and games. It also became a learning environment for me, because as I was collecting these skills or experiences, I was also learning from my failures. Because I mean, nobody's perfect. I can't say that everything I've done so far in my professional career has been spotless or perfect, but it gives you an opportunity to learn and accept those and then say, okay, maybe this was not, maybe technology and medicine was not a good idea when I was thinking about it, but now it's more relevant. And it really does make sense. It took 10 years for slowly world to evolve into how you make broader use of technology. And I come from healthcare world, so I will be the first one to admit, when I look at retail companies like Amazon and Facebook and other social media companies, there have been leaps and bounds like ahead of us. I mean, they knew what customers want. They could customize their preferences, target messages, and literally tailor everything around them. But I'm glad now that over the course of many last few years, that healthcare has actually really leapfrogged and has decided, how do we become patient-centric? How do we become physician-centric? We should not create barriers, but we should eliminate barriers and give them access and convenience, and make their life uncomplicated, make their life easy. And that's the goal. And all these things, they take time. Sometimes they're discouraging, but most of the times, these are the big bets you make, and some of them pay off and some of them don't, which is totally okay, because those are the risks as a leader you should be, or you should be willing to take. But you kind of balance it, that what makes the most sense, instead of just running after shiny objects. So in my career, it's sad that my dad passed away before he could even see me, what I have done in my life. I mean, I was still in business school when he passed away. But I always said to my mother that this is the most fulfilling thing that I have done, and I continue to learn. And another thing that has helped me, and I'm sharing these ideas, how I have not gone into a normal path, but I've gone into this eclectic path of defining my own journey, that I was asked by MIT, right here in Boston, to sit on their board for health advisory. And one of the most eye-opening experiences that I had is MIT is full of uber geniuses. Like they're super smart people. And I kind of felt like, okay, what am I learning from them? They are so smart, and I don't know. But I was asked to teach a class at MIT, so it's nerve-wracking to begin with. And I said, okay, challenge accepted, we'll do it. And went and attended the class. And here was the connection. I learned that all these uber geniuses, they really know their stuff. They know technology, they know their thesis, their PhD, or whatever master's they're getting in. The part that they were lacking in was business aspect of it. What people like me who are on the industry side or business side, what pain points are we looking for, and how do we solve that? So it's a great learning both ways. It was never a one-way street. I've been with them for now 4 or 5 years now. And same thing I do with Harvard. I sit on both of their advisory boards. But it has been a very symbiotic relationship. It's learning on both sides. I learn from their creativity, from their innovation, from their really smart minds and smart ideas. One of the ideas that I will share was, and it's public, so I can talk about it. They had a folding car. I actually saw a prototype for a folding car. And when I saw it, it was 1.5 years ago, I was like how? Like, what do you do? Like, how can this car fold into like a cardboard box? But it is true. They have cars like that. I mean, it's not operational. It's not on the streets. You're not going to see it. They have self-driving cars, which actually are operational. But the folding cars was just a problem that was presented to MIT for parking space problems in New York or Tokyo or Hong Kong. And they said if we had collapsible cars, that will open up the spaces. A brilliant idea. Geniuses at MIT made it happen, and it was a great opportunity for me to learn. So the point being, as long as you keep an open mind and you are willing to look outside your norm, to push the boundaries, to take some risk, and not expecting what it would be, the rewards are. It could be a learning thing, it could be a great success, or it could be just, fail fast, fail cheap kind of thing, but a great experience. So my life, I must say, has been extremely beautiful with all these variety of experiences I've had. I'm a mother to a 10-year-old beautiful child, and clearly I learned from him a lot. In honest confession, this quarantine actually has been very beneficial for our bonding process. I never knew how to play chess. And he said, Mom, I'll teach you. And I agreed to learn from him. And I would say 30 plus more days of counting that I have not won a single game. So I think it's rigged, but I would not admit it, that I am poor in playing chess and he's very good. But I did something new, and even that to me is now really a matter of joy, very fulfilling, that for somebody who traveled like a maniac and I actually didn't know how to live on a land, to be honest. And all of a sudden I get to live in a house for 2 months in a row and spend time with my son. Very, very humbling, beautiful experience. Maniacal, stressful, but I'm pretty sure, like I said, life was not perfect, but very, very humbling and very grateful. I think I'm getting a notification that it's time for questions. Sorry, otherwise I will ramble on for the next hour. But happy to talk about anything that is kind of burning on thoughts from your side, or whatever I could answer. Thank you for the opportunity, Helen.
Oh, my pleasure, and thank you. We really appreciate it. You have such an interesting path that's led you to where you are today. So I want to remind everyone to please, you can use the chat function to ask your questions. Feel free to take yourself off mute or off video, because I know it's been very challenging as a speaker to speak to no one, knowing they're out there, but that they're not visible. But I'll kick it off with a question about this idea that, we were talking a bit about telemedicine and how perhaps our use of it has accelerated during this time. Maybe a few comments on how, whether that will sustain beyond our crisis, and how the sort of marketplace may change because of this fast tracking of new technology.
Yeah, so good news and good news. Certainly, this is here to stay. The technology trend is here to stay, and one reason that is complementing it, and like I said, it is sad that it took a pandemic for us to do this, but we're now getting reimbursed, which means that we will get paid, like insurers like Blue Cross Blue Shield of Massachusetts, or Cigna, or Aetna, or even Medicare, which they are now going to pay for all this video consultation, which is a huge change from before, because some states were paying, some of them were not paying. It was just hodgepodge, many wildflower blooming approach, but now it is consistent. And I think that is great. It's a technology in making for the last 10 years. There are many, many great companies, including one in Boston. I'll just name it American Well. It's a Harvard company, and they started probably 10, 12 years ago. So they've really been at the frontiers. And the latest studies that have come out, even if like we have the recent pandemic, given that how the hospital systems have been burdened by it, and to recover from it, it will take some time, that this is a trend there is to stay. And I don't think so many people, for minor ailments, it's really a good way to get care.
Hmm.
And they're all electronic. So another beauty of it is nobody is doing paper records now. It's all on electronic medical records. So again, your records are being maintained and kept through technology.
Great, thanks. We have a question here from Suzanne. I don't know if you want to take yourself off mute and ask yourself, otherwise I can read it. Okay, I'll read it. It's hard to do hindsight. Oop, I've lost it. One moment. It's hard to do hindsight objectively, but do you think that any of the tech geeks, a positive career, were thinking how telehealth could be used during a pandemic?
So when you say tech geek, like what exactly, like, is it as a profession how they will do, or the question is more around care? I mean, to me, that's not clear. If Suzanne can just clarify that for me, I'll answer it both ways then.
Here, let me see. I don't think I need to take you off mute, but maybe.
She wrote in their think tanks, I guess. Let me see. Hi, Rajni. Oh. So for tech geeks, one way I can see about, and I'm reading the chat question actually.
Okay.
One way I can see that telehealth could be used, actually 2-3 ways. First of all, every technology needs a UI, UX interface and a platform and a software and a backend system. So if you are into the software sort of field, clearly that is where all of your qualifications can come into play. But I would take it a step further. Like I was talking about the personalization, the knowing you, what is in it for Rajni. So that is where the data comes into play. So a lot of tech geeks, when I think about tech geeks, I think about PhD in data scientists, people who have devoted their life to data and mining the data and extraction of data, and then making sense of data. So creating intelligence out of that data. And those jobs, even not for future, even today, like if telemedicine is another way that your information is getting exchanged. So anytime an exchange happens, the data is created, the data set points are created. And to make sense of that data, like I'll give an example. How many times Rajni called for common cold? And if it is more than 3 times, Rajni definitely have issues. But if it is once, then, it's fine. It's part of our natural history. So the data can get intelligent about giving you or presenting you with intelligent information that the healthcare provider can use on their own as needed. So I definitely think it's going to have very, very positive impact. And it's not even the question of future. It's happening right now. And this is where the advanced analytics, the automation, the intelligence happening on their own, or even like Google and Alexa, like things like AI or machine learning, they're all happening. It's not a thing of the future. So tech geeks are very secure.
Thanks. We have a question from Wendy. Can you discuss something specific you're working on now for Sanofi Genzyme?
Yeah, so it is. So let me talk about something digital, and which is actually related to my job, but Sanofi definitely has a medicine that came out for asthma and also for a skin condition. It's called Dupixent. And very recently, we're working on patient experience. And what it means is, how do we make their lives easier? And one of the things that we have done is we have created the apps where they can, patient can log into their symptoms, record their symptoms, even take pictures, and then communicate in a forum and say, how is the disease progressing or controlled and whatnot. And that is one way to look at it, that you have a product, which is a medicine in our case, but for a software company, it may be a licensing software. But for Sanofi, it's a drug or a medicine. And we are creating scenarios around the medicine. It's called around the medicine or beyond the pill approach, where we are providing support to not only the patient, but also their prescribing providers. And they can all do it in the safety and comfort of their home. So this is something that if they are taking medicine, can they record an adverse symptoms? Is the medication working for them, and things like that, or how are they feeling, whatnot. And this is one way of digitally interacting with the ecosystems, whether it is healthcare providers or whether it is a patient. Another example I would give is, we talked about telemedicine, is remote monitoring. It's like really, this is happening. I'm not talking about rocket science, guys. It's not alien science, it's happening. Like if I step on a scale, my scale sends information and it goes into a cloud-based system and ultimately recorded, and it tells me how Rajni is doing at our house. Every single day, it will calculate my weight or my blood pressure. So all these things that are happening is connecting the ecosystem of patient, provider, drug manufacturers like us, Sanofi, and then also providing information to patients. What should they do? The instructions or recommendations or education, all of this can be facilitated. And an empowered patient, an informed patient is the best patient. And that's our goal at Sanofi. And we strive literally every day for it and work very hard.
Thanks. We have a question from Harika. When and why did you decide to go to med school?
That was not my decision, in all honesty. So I must admit, I'm an Indian immigrant to US, and I said my father was an engineer. In all honesty, there was no physician in our family, none. And he was very motivated that there should be at least one person in the family who could have an MD. And apparently I fit that bill, and it's only me and my sister, and she's actually an attorney. So I was the younger one, and because I had interest in biology, so I think I got a little nudge from him to say, what do you think about going into medicine? And I said, oh, I don't know. I mean, I like biology. I mean, I don't know about it. So the decision wasn't mine, but then the interest to stay in it was definitely mine. And it actually, I kind of like it how my career path evolved. And the beauty of this is that none of this was planned, which is what I like about it. I mean, everything that I have done as of today, none of those were planned. I have taken jobs, and this is all in open transparency. I know Wendy's on the call. Sometimes I've written my own job description because people get confused, like, where should we fit you? And I'm like, isn't that beautiful? I don't fit in a box, and to me, that's the beauty of it, and that's how everybody should be. You should be multi-dimensional, multi-eclectic, and have a personality that that can bring that to reality, that passion, that interest. So I have been very fortunate. And then once I got into medicine, like I said, I discovered I had love for business. Once I went into business, I discovered I had love for technology. And then I realized that I have love for my son, who's 10 years old, came into my life and made me mother. And it's the most beautiful thing. So, sorry, a little personal thing there.
That's what makes it more relatable. Thank you. We have a question here from Saket.
He doesn't take advice from me, though. I must say, yes.
A question here from Saket. Do you think that more and open medical data could help battle such problems like rapid pandemic spread, et cetera? Or would it be best to keep all research with traditionally reliable sources like universities? Reliable is in quotations.
Yeah. Well, first of all, I am amazed at the caliber of questions. I mean, you guys are like just crushing it. So I have to bring my A game. So thank you for asking such intelligent questions, because they make me think. And you're absolutely correct. You know, the data and the open data exchange, or even the data protocol and standards, universities, that's a thing of the past. Not to say that they don't serve a purpose, they definitely serve a purpose because they're a neutral body. Like when you are into a private company, the data is owned by a private company. But when you are part of an academic institution, that's public data. So you definitely benefit from public-private partnership. But when Obama administration was there, not sure how many of you are familiar with it, but he introduced something like HIE, or Health Information Exchange Act, and and I won't go too much technical on it, but going back to your point, yes, I think the open data exchange sources, all of this is very critical. Now, even more so after or we're still in the pandemic, with that the universe has to come together. And the universe is just not hospitals or pharmaceutical companies or pharmacies or hospitals. The universe is all of them combined. And we have in US, actually, Sanofi is a global company. So I must say, or if you look at countries like UK or Canada, they have one payer, which means one national healthcare system. There is no United, no Aetna, no Cigna, just one. So in those scenarios, your access to data and access to clean data and the governance and standards are really much better as compared to ours. But certainly, I think in the last 7 to 8 years, a lot of progress have been made by e-health initiatives, health information exchanges, the Obama rules that came into play, electronic medical record. So it is definitely for the future. And everybody is working on it. Just in all reality and transparency, are we perfect? No. Are we there yet? No. But are we working on it? Yes. But everybody has to come together. And in today's world, we do have a tendency of keeping it very close to our chest. And sometimes for the right reason, you do it for the greater good. And I think for COVID, certainly a lot of organizations have stepped up for the benefit of the world, for the benefit of the greater good, and the right thing to do.
Great, thanks. So as we wrap up, I want to give anyone another opportunity to ask a question. And if not, I will ask the closing question. I don't see any others that are coming through. As I said that. Okay, here we go. What was your favorite project you've worked on? Sounds like that might be a challenging one, given the breadth of experience.
Well, favorite project, so I will give two. I'll give two. So one is a baking project with my child that I completely screwed up, because even though I thought I was good in science, I completely messed that up. And the muffins that I was supposed to make turned out to be rubbery. So with that out of the way, that is the bonding experience. It's very hard for me to pick a favorite project. But I think one of the things that makes me super, super, super happy is, this is true story. I develop a lot of new products. I used to, and not at this job, but in my previous job at Humana, I used to run innovation for entire Humana, which is like a pair. We used to run user group, or we'll bring our patients in and say, critique, whatever I have created, critique. And my favorite part was I built this beautiful diabetes app and had all the content and information, you name it. And then I had somebody who was like, 60-something-year-old, and he said, I like all this, but can you tell me what hypoglycemia means? And as a doctor, it was very easy for me. Oh, it's low blood sugar. But what I failed to understand was I need to not do this in a medical terminology. I need to do this in what patient wants, what consumer wants, what a user wants. And that was a great learning experience. And actually, it did motivate me for the first time in my life to look at it from a different angle. I was always looking at it from a business, clinical, technology angle, but it opened my eyes to say, ultimately, who am I serving? And the person am I serving? Am I doing the right job? Am I fulfilling that purpose? And I failed at that miserably. And there were some other great critiques. And when I took all that criticism and we went back to drawing board and created a new product, I think that was very exciting for me, not only as a learning curve and to be a good listener, but also just to be very humble, just to say that you don't know it all. And if you are ready to go back and start from scratch and start fresh, and then take feedback throughout the way from people who actually are going to use it, you might learn more. So I think that was very exciting.
Great, thanks. So in closing, perhaps you can reflect on your younger self and share
I'm very young.
your high school self, I should have said, to be clear, your high school self. And any words of wisdom you would have imparted to yourself at that point about the future.
When I was in high school?
Yeah, so a lot of the students on our call today are in high school, and so perhaps could use some pointers as they think about their future.
Well, so I will not sugarcoat it or candy coat it. I must admit, in high school, I was quite clueless. But the good thing was my dad sort of saw that what I was interested in and steered me and guided me in a direction that he thought would be beneficial for me. And I'm eternally, eternally grateful to him for that. I think the guidance and the advisory, the advice that I got from him really helped me shape who I am today. His job was just to nudge me, but when I get like, I don't know what I want, and do I want to do this, and this is how I was. And you know, looking back, that was so many years ago. If he wouldn't have given direction, I don't know what I would have been. But because of, I think, his guidance and his curious nature and his advice and the ability to guide me throughout, even after my med school and the business, I basically said that how shocked he was that I went to med school for 13 years and then decided I want to go to business school. He still supported me, and I think that's very important, that have people believe in you, even if you're taking a risk, even if there is an unknown, even if you don't know what the path looks like, but it feels like the right path, and it actually fuels your passion. It has to come across. You know, to me, that's the beauty of it. Whether it is studying or working or whatever it is, you just you have to go at it and give your 100% and say that, okay, under the circumstances, you made the best choice, and you take the decision whatever feels right to you.
Excellent advice. Thank you.
Yes.
Well, from all of us on the call today, I really want to thank you for your time and for walking us through these decisions you've made and your background. It's been really illuminating. And thank you all who joined the call for your fantastic questions. Really, really great, thoughtful ones. We have 2 more speakers for the rest of our speaker series. I want to let everyone who's on know that. We have one tomorrow and one next Tuesday, and then we'll conclude for the season. But if you're interested in any specific topics, if you have further questions from our speaker today, you are most welcome to email us, info@scifair.com. And the details of our subsequent talks will be on that same website, scifair.com. You can also link, if you missed some of the prior calls, you can link in and see the videos. We've uploaded them as we do them. Yeah. So again, thank you so much for participating, and enjoy their afternoon.
Wendy and Helen, and thank you for the opportunity.
Thanks, Rajni.
Great to be with all of you. And like Helen said, feel free to reach out if I could be a trailblazer for any one of you. I'm happy to.
Wonderful. Thanks so much.
Take care. Bye-bye.
Take care.
Thank you, Helen. Good luck, you guys.
Bye.